Have you been told that you can't deadlift because of a herniated disc? Maybe deadlifts will make it that much more worse and you won't even be able to walk. Well, today we're going to talk about exactly this. What's up, everybody? My name's Dr. Michael Mash. Welcome to this week's Whiteboard Wednesday. So when it comes to deadlifts and herniated discs, there's a few things that we need to talk about first to see if it's okay for you to deadlift with your herniated disc. Number one, are there red flags? These are symptoms that you may be experiencing that you probably shouldn't be deadlifting with a herniated disc, and you probably should get it checked out first. Before I scare you into all the crazy things that could be going on, some things that you want to look out for. Are you having inability to move your legs? So if you're unable to move your legs, you probably shouldn't be deadlifting. You should probably go get that checked out. Another thing you want to look for is loss of bowel and bladder control. Again, that should be a dead giveaway that, hey, something else is going on here. I'm unable to control my bowel and bladder. Or something we call saddle paresthesia, which is numbness in the groin area or numbness on the inside of the thighs. If you're having any of these symptoms, go get it checked out by a doctor. Deadlifts aren't going to fix it. Other things you may want to look out for is your back pain worsening. Are you also having a fever with your back pain? This is an indication that something else would be going on. All of these things I just mentioned are called red flags because while they may not indicate something is going wrong, it's an indication that you should go get it checked out first prior to moving forward. So, number one question, if you can deadlift with a herniated disc, if you've been told that you have a herniated disc and you're experiencing any of the symptoms I just mentioned, the answer is no. Go get it checked out. Number two, we want to look out for, are there radicular symptoms? Are you experiencing pain or numbness down a leg? If this is the case, this is probably something you don't want to deadlift or train through. This is something you'd want to get checked out by a rehab professional like a physical therapist, chiropractor, somebody that understands the nuances of barbell training. You want to get it checked out first prior to deadlifting. Because if you're having pain, numbness down one leg, it usually feels like a tight calf or a tight hamstring or both. This isn't something that you want to aggressively train through. You may need some other instruction and other tactics to help reduce it prior to doing your deadlifts. These radicular symptoms, pain, numbness down one leg, aren't usually a red flag, like an indication that something serious is going on, but it is an indication that, hey, I should get this checked out prior to loading it up. So, are you having radicular symptoms? If there's no red flags, you don't have any kind of shooting pain or numbness down one leg, but you have been confirmed that you have a herniated disc and maybe you just have back pain. The next question I want to ask you is, can you tolerate the variation of your choice? Can you tolerate the deadlift variation of your choice? Let's say it's a conventional barbell deadlift. So let's say you have back pain, a herniated disc, but no leg pain and no red flags. Can you conventional deadlift? Have you tried decreasing the load? If that doesn't work, then you need to find a variation of the hip hinge that you can tolerate. And it is safe to deadlift. It is safe to hip hinge. So this may be a dumbbell or a kettlebell RDL. Maybe that's where you need to start to reintegrate the hip hinge pattern before getting back to the conventional deadlift of your choice. So the big picture of it is, if you have a herniated disc, you can probably deadlift provided that you don't have red flags and provided that you don't have significant radicular symptoms. You just need to find the hip hinge or deadlift variation that you can tolerate, and you need to also load it appropriately. Now's not the time to chase performance, to chase 1 rep max, to chase high rep AMRAP sets until absolute failure. Now is the time to slowly build up your tolerance at lower intensities, a little bit of weight at a time until you're back to baseline to where you want to be tolerably, and then you can switch for performance goals. One thing I'd like to talk about is the prevalence or the incidence of herniated discs in people that have no pain. Let's look at it this way. If you're in your 40s and we put 100 people in their 40s into an MRI without any back pain, about 30% or about 1 in 3 are going to show herniated disc. So these herniated discs, they show up on MRIs and they don't always equate to the symptoms you're having. You can't go by what the MRI says, you have to go by what you're feeling. Are you having red flags? Yes, okay, I need to go see somebody. Are you having shooting pain, numbness down one leg? Yes, I am. Let me go to a rehab professional, take care of that first before I'm deadlifting. But if you don't have any of these two things, it's go time. Find what you can do and load it appropriately. RDLs, dumbbell RDLs, trap bar deadlifts, sumo deadlifts, trap bar deadlifts from blocks, block pulls, rack pulls. I'm just firing off all these different hip hinge variations that you can do in order to start training the deadlift pattern. Number 4, is it stable or is it worsening? This is something you got to ask when you're sort of deadlifting and there's a little bit of pain involved. Is it a tolerable amount of pain? Is it 3 to 4 out of 10 pain during and also stable the next day? Then you're probably good to continue. But if you're consistently and always flaring up your back, or your back's always sore or always hurt the day after deadlifts, this is not something that's normal. This is an indication that, hey, I need to either get this looked at, I need to really dial in on my programming, or I need to choose a different variation. So, is it stable or is it worsening? Big picture, can you deadlift with a herniated disc? Absolutely, provided that you're not showing red flag symptoms and you're not aggressively loading through any radicular symptoms as well. I hope you found this video useful. If so, please subscribe to this channel. Hit that subscribe button so that I can get this out to more people. Thank you for watching this Whiteboard Wednesday, and I will see you next week.